Have you ever considered how a common medication, often used to reduce inflammation throughout the body, might silently impact one of your most precious senses, your eyesight? It is a connection many people do not realize, but it is incredibly important to understand for your long-term eye health. Steroid medications can indeed significantly increase your eye pressure. This rise in pressure is a known side effect that can occur with various forms of steroids and can potentially lead to serious eye conditions if not managed properly. The core mechanism involves how steroids interfere with the natural drainage system of your inside your eye. A clear fluid called aqueous humor constantly circulates. This fluid is essential for nourishing the eye and maintaining its shape. Normally, after circulating, this fluid drains out through a microscopic, mesh-like tissue located at the angle where the iris meets the cornea. This tissue is called the trabecular meshwork. When you take steroid medications, these powerful anti-inflammatory drugs can cause structural and biochemical changes in this meshwork. They can make the meshwork cells less efficient at filtering and draining the fluid, or even cause the meshwork to become partially clogged. This reduced drainage leads to a buildup of aqueous humor within the eye, and that buildup directly causes your intraocular pressure to rise. This effect can happen regardless of the administration route. Whether you are taking oral steroids like prednisone, using steroid eye drops for allergies or inflammation, receiving steroid injections near the eye or into a joint, or even using inhaled steroids for respiratory conditions, the systemic absorption can still potentially impact pressure. The risk and degree of pressure increase depends significantly on factors such as the specific type of steroid compound, the dosage strength, how long you use it, and your individual genetic sensitivity. Some people are simply more prone to this steroid response than others, often due to an inherited predisposition, making careful monitoring even more vital. If you are prescribed any form of steroid medication, especially for long-term use, it is crucial to inform your eye doctor. They will likely recommend regular eye exams to monitor your intraocular pressure, which is simply the pressure inside your eye. Never stop taking a prescribed steroid medication abruptly without consulting the doctor who prescribed it, as this can have serious health consequences for the condition it is treating. Instead, work collaboratively with both your prescribing doctor and your care professional to manage the risks effectively while ensuring your overall health is maintained. This condition, where steroids cause elevated eye pressure, is often referred to as steroid-induced glaucoma or ocular hypertension. It is important to understand the distinction. Ocular hypertension simply means your eye pressure is higher than normal, without any measurable damage to the optic nerve. However, steroid-induced glaucoma implies that the persistently high pressure has already begun to cause irreversible damage to the optic nerve, which transmits visual information from your eye to your brain. Early detection through routine, comprehensive dilated eye exams is incredibly important. High pressure typically has no noticeable symptoms until significant and often irreversible vision loss has already occurred, earning it the nickname, the silent thief of sight. Your eye doctor can use specialized diagnostic tools, such as tonometry, a quick and painless test to accurately measure your eye pressure. They can also use optical coherence tomography, or OCT, to assess the health and thickness of your optic nerve fibers, and visual field tests to check for any loss in your peripheral vision. These tools help them track changes and intervene early if necessary. Understanding this potential link between steroid medications and eye pressure empowers you to take proactive steps to protect your vision. By staying informed, communicating openly with all your doctors, and keeping up with regular comprehensive eye health checkups, you can effectively mitigate these risks and maintain healthy eyesight for years to come, even while managing other important health conditions.